Welcome everyone. I'm Alicia from Legacy's communications team, and I'll be serving as the moderator for this event. Thank you so much for joining us. Tonight, we are going to talk about sperm health and male fertility, specifically as it pertains to trying to get pregnant or planning to try soon to get pregnant. As you might be familiar, we probably spend most of our adult lives, or since we're teenagers, like specifically trying not to get ourselves pregnant or to get someone else pregnant. But now that you might be ready to start or you're considering starting a family, we're going to discuss how you can best plan for that. We're going to talk through sperm quality to understand the metrics that are used to measure sperm health, the factors in your medical history, your lifestyle, and your environment that actually could be impacting or reducing your fertility. And we're also going to talk through what men and couples can do to optimize their sperm health and increase their chances of getting pregnant. That's what we're here to do. This event is sponsored by Legacy. Here's a little bit about what we do here. Legacy is a sperm testing and freezing company. We offer at-home sample collection for semen analysis, DNA fragmentation analysis, and sperm cryopreservation, which is sperm freezing. We also offer STI testing, supplements, and virtual fertility care to help you improve your fertility. So we're really here to be your partner on the journey, whether you're ready to have kids now or you're planning ahead for the future. And this is all virtual, all from home. So it's really accessible and affordable for you no matter where you are in your journey. Our fertility experts tonight is Stephanie Saborin. Steph is a nurse and the head of clinical services here at Legacy. Her professional background is in urology surgery, specifically in men's health. She's been working in this space for the past decade. She's certified in andrology. Andrology is the science of sperm and men's health, so she's an expert in this space. She's a member of the American Society for Reproductive Medicine. Here at Legacy, she has two roles. She serves as a clinical educator, in my opinion, one of the best, teaching other providers about male fertility and sperm. And she also sees Legacy patients, working with individuals and couples who are looking to better understand their fertility and improve their fertility. So if you schedule a fertility consultation with Legacy, you very well might meet with Steph herself. So Steph, take it away.
Beautiful. Thank you so much, Alicia. I appreciate it. And thanks everybody for being on here. This is so different when we do these webinars and I can't see anyone and I don't know who's here, but welcome and we're glad you signed in. So in order to conceive, you need three things. You need healthy sperm with healthy DNA. You need a healthy egg with healthy DNA. And you need a healthy uterus and fallopian tubes. So seems pretty simple, right? But sometimes we take our fertility for granted and do not realize the complexity there actually is to conception. Infertility or fertility in general even, has historically been considered a female issue or woman's only issue. But in fact, infertility is just as likely to be male factor as female factor, with 50% of all cases being male causative, meaning that the male is the reason that the couple is having fertility challenges. Now, understanding sperm quality is really important. So there are key components that you need to know about when you're discussing sperm. For one, concentration or count. Those terms can be used interchangeably. This is how many sperm we're seeing in any individual sample. There's DNA fragmentation. You'll hear a lot of talk about that today. A sperm DNA fragmentation analysis is an advanced male fertility test that measures the percentage of abnormal or damaged DNA carried by sperm. Now, a high level of sperm DNA fragmentation can contribute to infertility, issues with recurring miscarriage, or even poor health outcomes for your future children. We'll also talk a little bit about morphology. Morphology refers to size and shape of sperm alone. So with morphology, that's what I refer to sort of as the grayest of all the gray areas in fertility, and there are many. And that is just the parameter that is least understood by the science community as a whole. There's a lot of question marks surrounding morphology. Now, motility talks to us about how the sperm themselves are swimming and moving. So good motility is key in natural conception, especially, and we'll talk a lot about that. And then lastly, volume. So volume is the amount of ejaculate that's being measured. Sperm are a very small component of the ejaculate, which is predominantly consistent of just seminal fluids. So Typically, when we're looking at fertility reports and fertility in general, the total motile count is really a key indicator as far as someone's likelihood or probability of conceiving via natural conception. What the total motile count is really just some simple math, a mathematical calculation that's factoring in the three most important pieces on a semen analysis report. So that's going to be the concentration or count of how many sperm we see in the sample, the volume of ejaculate that the sperm are contained in, and the motility, which again, like I said, tells us how the sperm themselves are swimming and moving. There are many things that can impact sperm quality, and I'll touch upon some of the most common. So first, we're going to start with genetics. Genetic anomalies account for about 15% of cases of infertility. So the primary types of genetic disorders that are going to be causing male fertility, and there are many, but just a few of the most common are going to be things like cystic fibrosis gene mutations, chromosomal abnormalities such as Klinefelter syndrome, could be Y chromosome microdeletions of genes, Noonan syndrome, and chromosomal translocations. Now, you could probably do an entire webinar on genetics exclusively, but unfortunately, we don't have time to take that deep dive into that topic tonight. It'll be referenced a little bit later, very briefly, but it is quite an interesting subject. But let's start off with the easy stuff. So we'll talk about age. So age, and more importantly, age's impact on fertility. So men over the age of 40 are 30% more likely to experience infertility compared to men in their 20s. A more alarming fact is that sperm from people over age 40 has a 6 times higher likelihood of producing a child with a congenital condition. So this includes things like autism spectrum disorder, bipolar disorder, schizophrenia, or even some childhood cancers. Now, every year, sperm quality declines with age, making it harder to become pregnant. Motility declines by almost 1% every year. Additionally, morphology decreases, and on average, 1.5 new genetic mutations are going to continue to develop year after year. DNA fragmentation, which is damage to the genetic material carried by sperm, also increases with age, making conception after age 40 that much more difficult. Now, this information here was from a study that was done on a group of about 475 men that were presenting for infertility. DNA fragmentation results of this population are all elevated, but we're seeing even higher elevations related to the higher age brackets, which shows just how much of an impact age is having on these levels of DNA fragmentation alone. Now, lifestyle, this is an important topic as well, because most people don't realize how big of an impact lifestyle can have on our fertility. Some of the largest impacts from lifestyle are going to be coming from our diet, smoking cigarettes, cannabis-containing products, either smoked or edibles, recreational drug use or alcohol usage. It's going to be sleep, exercise habits, and really anything that causes increases to scrotal temperature. And we'll talk more about those lifestyle tidbits a little bit later on. So fun fact time, your testicles are on the outside of your body for a reason. That reason is that they like to be about 3.5 degrees cooler than your internal organs do. Now, every guy knows what happens if you jump into an ice cold body of water. What happens first? Your testicles immediately are going to pull up tight to the body. This is a self-warming mechanism, right? So this should be resonating with some of you. Just like when you're outside, if you're sweating it out on a hike, it's 100 degrees out, your testicles are going to hang looser and lower from your body. That's their self-cooling mechanism. Now, anything you do that's going to inhibit your body's natural ability to self-regulate temperature can negatively impact sperm production and your overall sperm health. So a few of the most common things that are going to cause overheating to the scrotum are going to be things like saunas or hot tubs, or even just soaking in a regular bathtub, taking a bath. A fever, if you're sick, could be working with your laptop computer actually on your lap. Not great for fertility. Wearing fitted pants or undergarments. So this can be things like briefs, boxer briefs, compression shorts, running tights, skinny jeans, anything like that. Also biking, or anything that we would refer to as saddle sports. So that's going to be things like a regular bicycle. It could be an exercise bike or Pelotons, a motorcycle, horseback riding, really anything that has you seated in a straddled position. And then not included on this slide, but very important this time of year, especially because I know I'm based up here in the New England area, the heated seats in your car. People don't think about that. Many people are using their heated seats. These are things that definitely can have a negative impact on fertility. Just like also not listed on this slide, but equally important to mention because of its popularity is hot yoga classes. I love yoga, yoga for wellness and for health, fantastic. Not a fan of the hot yoga because again, it's just putting you in a situation where your body is too hot for what your sperm like to be. So lifestyle adjustments can significantly help to improve sperm health. And I'll touch upon how in a little bit when we start talking about specific recommendations, but we'll move it along and talk about medical history and medications next. Now, this is definitely not an exhaustive list, but a few of the most common offenders when it comes to medications. So first off, chemotherapy, any sort of chemotherapy, and I would include radiation in there as well, although radiation isn't a medication particularly. Testosterone, which could be taken for many reasons, deficiencies or for vitality, athletic performance, but all testosterones are going to have an impact on fertility, as well as anabolic steroids or anything you're getting from a guy at the gym out of a duffel bag, wink, wink. I think you know what I'm talking about here. Then we've got, things like finasteride or Propecia. This is a medication that in higher doses is used for prostate issues, lower doses for hair loss prevention, very commonly prescribed medication that has known impacts to fertility. As well as SSRIs. So these are a particular drug class of antidepressants. Not all antidepressants are in the SSRI drug class, but that particular drug class will have a negative impact directly on fertility. And then also alpha blocker medications. Alpha blockers can be used for lots of things. Most commonly, we're seeing those used for things like high blood pressure, anxiety, migraines, prostate issues, or even kidney stones. So an important note that I want to make clear too is that I do not want anyone to stop taking a prescribed medication without speaking with your doctor first. These are things I'm telling you about, but I definitely do not want you to cold turkey on prescribed medications here. That can cause problems in and of itself. Also, the best resource as to whether any particular medications, if you're questioning that a prescribed medication, if it is impacting your fertility or could, honestly, the best resource is your local pharmacist where you're filling your prescriptions. Go ahead into the pharmacy. They have that window where you can ask a pharmacist questions. Go talk to them. They can take a look at your medication lists and advise accordingly. Now, aside from medications, there's also underlying medical conditions that could potentially be impacting your fertility. Again, this is not an exhaustive list. There are many. These are just some of the most common. The first most common, where I'm always so surprised because they're extremely common and most people have never heard of this when I bring it up, but is something called a varicocele. Now, varicoceles are not dangerous at all. And in fact, 14 to 18% of all adult men have them. For many men, these varicoceles will go unnoticed or undiagnosed throughout the course of their entire life and will most likely never cause problems at all. What they are really are just dilated or enlarged scrotal veins. These are things that are internal, not external. So most people, again, wouldn't know they had them. But they can impact fertility by causing an increase to internal testicular temperature due to some of the pooling of blood, which subsequently is going to decrease sperm production and sperm quality. Now, varicocele repair, which is a surgical procedure, can help increase fertility by not only restoring adequate blood flow to the scrotum, but also increases sperm concentration and motility. And also varicocele correction helps to improve testosterone production, which would also help to improve testicular volume and decrease sperm DNA fragmentation, which we like. We want those DNA fragmentation numbers nice and low. So aside from varicoceles, we've also got STIs. So sexually transmitted infections can impact fertility. Some very common ones, and only naming a few, would be things like gonorrhea, chlamydia, or HPV. These impact male fertility in a few different ways. So there can be some scarring or strictures that are formed in the male reproductive tract, causing issues with sperm being able to pass through. There can be inflammation or damage to sperm motility and increased levels of DNA fragmentation. And also, if an STI such as chlamydia or gonorrhea is left untreated, this can cause permanent damage to the testicles, causing infertility where there may not have been before. Hormone balances or imbalances, I should say, are another issue. So hormone imbalances, these can be identified through blood tests. This can be blood tests ordered just by your primary care doctor. It's important to know, though, that these tests are not things that are routinely ordered in an annual physical. So it's something you've likely never had done. This is something that you would speak to your doctor about if you felt that you needed to have it looked at, if you had concerns after doing a semen analysis test and after making some lifestyle adjustments, and if still no improvement was seen. Then you could look into whether or not you would be a candidate to have some of this blood work looked at. Absence of vas deferens. The vas deferens are the tubes that help to transport the sperm to mix in with the semen and to become part of the ejaculate. Congenital bilateral absence of vas deferens is a medical condition that affects about 1 out of every 1,000 males. But most commonly, it's really people who have cystic fibrosis. So that's found in 98% of males with cystic fibrosis, and it accounts for about 6 to 8% of all cases of obstructive azospermia. Azospermia is a condition where no sperm is seen in a particular semen sample. Not very common. Typically, again, it would be someone who had family history or a personal history of cystic fibrosis that would have that. Now, exposures to chemicals and plastics. So these are those endocrine disrupting chemicals that we're always hearing about in the news. I feel like I'm hearing more and more and reading more and more about this all the time. Endocrine disrupting chemicals impact our hormone systems and subsequently our fertility. So these are found in everyday products in our homes. And again, not an exhaustive list. These are just a few of the common things that you would find them in, but things like pesticides, things you're using when you're gardening, in our plastics, bottles, packaging that our food even comes in, fragrance containing products. This can be anything with a scent. So candles, air fresheners, lotions or body products, soaps even, and many more. Lead or any heavy metals, and also flame retardants. And flame retardants, people think of not something that they maybe are coming in exposure with, but you don't even realize this is used in clothing fabrics, even children's pajamas. This is something that we are coming in contact with in many cases, having no idea that we are. So the average person is exposed to 10 or more different endocrine disrupting chemicals every month. This number can be even higher based on what you do for a living. So there are some higher risk jobs, things like military service, if you're working for an airline or exposed to any sort of jet fuels, working at the airport, farmers or farming, agricultural work, or even firefighters. And those are just a few that are going to have much heavier exposures. A less than fun fact is that we consume up to a credit card's worth of plastic every week. That is a staggering amount. That's the equivalent to 50 plastic bags per year. When you think about that, you're consuming 50 plastic bags a year. It's kind of horrifying. So the largest source of this plastic ingestion that we're doing is through our drinking water, surprisingly. But another major source of it is shellfish. And this is all in the form, of course, of microplastics that are contaminating our fish supplies and our water supplies. Now, endocrine disrupting chemical exposure and lifestyle are two major factors believed to be contributing to worldwide global declines in sperm counts and quality. Globally, fertility rates have declined by half over the last 70 years. So this means that we are only half as fertile as our grandfathers were. Sperm counts are declining about 2.6% year over year. The average sperm count in 1973 was 99 million sperm per milliliter, so measuring volume here. In 2011, so that's only 38 years later, average sperm count dropped more than half down to 47.1 million per milliliter, and these numbers continue to drop. So this is concerning. Now, we're at the home stretch here, so I know that this has been a lot of information, and some of it feels a little doom and gloom probably, but we'll get to the good stuff and talk about how to optimize your chances at having a healthy pregnancy. So 3 steps to trying to conceive. Step number 1, improving sperm health. Step 2, testing male fertility. And step 3, getting the timing right. So starting with improving sperm health. This is my bread and butter. This is what I do all day, talking to people about how to improve their sperm health. I'm going to start you with diet. Now, This chart's going to give a great picture of what your diet should look like to optimize your fertility potential. If you'd like to, pull out your cell phone, take a quick picture of this chart. This will help you later to reference. I love this diagram because it's simple. It just makes sense. It's not complicated or confusing. So there is no specific magic food you can eat in order to improve fertility. That's a question I'm asked almost every single day. What should I be eating? There isn't a specific thing. It's really more about just simply maintaining a normal, healthy, well-balanced diet. So this chart can help you understand what that would look like in very simple to read terms, things that you want to be consuming more frequently and things you want to consume on a more sparingly. Now, exercise. So exercise, moderate exercise is recommended for everyone. This can look like many different things, such as jogging, weightlifting, walking, or yoga, not that hot yoga we talked about. If you have not left your couch or seen the inside of a gym in the last 5 to 10 years, that's okay. But please don't go crazy and join a CrossFit gym tomorrow, start taking boot camp classes. Really start slow, keep it moderate exercise. You are much more likely to just hurt yourself by overdoing it, and then you won't be doing much of anything. So exercise will go right out the window. So research studies have shown us that the biggest improvements in sperm health related to exercise actually just come from those moderate intensity workouts anyway. So that means that walking or jogging for 30 to 60 minutes for 3 to 6 times per week, that's it. This moderate exercise yielded better results than the much more vigorous or higher intensity workouts. So truly just get out and take a walk. And if you have a dog, they'll thank you for it. So that's my advice. Keep it simple. Don't go nuts with the exercise. Now, sleep. Sleep is something that most of us do not get enough of, myself included, I will admit. It is an extremely important part, though, of your body's recovery process. And good quality sleep is needed for good sperm health. This is important. So you should be aiming for 7 to 8 hours a night of uninterrupted sleep. That means, turning that TV off, staying off your phone in bed. That's something that really gets in the way of a lot of people's ability to fall asleep or have good sleep. For many of people, adding an extra hour of sleep actually outweighs an extra hour in the gym. So really try and prioritize and get more sleep if you can. Your body will thank you for it. Often we also talk about supplements. Supplements have been heavily researched over the years, and there is clinical evidence that certain supplements do improve sperm quality. Usually I recommend through 2 different courses of supplements, and usually it's based around what people are taking already. That does need to be considered because we don't want to double anyone up on anything. But typically the first and easiest recommendation would be to find a comprehensive male fertility supplement. Now, they are not all created equal, so it is really important that you're checking and reading labels. Fertility supplements, many of them, they're on the right track. They've got the ingredients right. The dosing is not always correct. So the key pieces of information, grab a pen and write this down or take a picture of the screen, is that you want to be looking for something that has specifically 300 to 400 milligrams of CoQ10 or coenzyme Q10. You need to get that much every day. Also, you're going to be looking for things that contain vitamin C, vitamin D, could have zinc, magnesium, folate. I'm going off slide, but these are just a handful of the many ingredients that you're going to find in a fertility supplement blend. That's where you're going to get the most bang for your buck typically. If you were to purchase all of the various supplements that are in a fertility supplement blend, you're going to be taking 30 different pills and potentially breaking your bank account. So that's usually, the most efficient way to get in everything you need. But if you didn't want to go with a comprehensive male fertility blend, the second option is pretty simple. I usually start people with just a generic 1 a day men's multivitamin. These are over-the-counter medications you can find at any retail establishment. So just a 1 a day multivitamin. And then I would make sure that you're adding in 300 milligrams of CoQ10. Again, read the labels. They come in lots of different doses. I'm also a big fan of vitamin C. The dosing on vitamin C is going to be 2,000 milligrams. I know it might sound like a high number, but honestly, your body's going to excrete most of this. The absorption isn't great when you're taking supplemental vitamin C, so it's good to have at least 2,000 milligrams a day. And another thing that I really recommend often is something called ashwagandha. Ashwagandha is an Indian ginseng supplement. The more I'm reading of the research on it, the more I like it surrounding what it's doing for sperm health. Ashwagandha, my recommendation on that one is usually, and this is surrounding the research that's been done, is 675 milligrams. That seems to be the most commonly used dose in all of the research studies that I have read. I do warn people in advance, though, sometimes you'll never find ashwagandha in a fertility supplement blend, and it's because it can have a bit of an unpleasant smell or taste to it, which really puts people off. So I try to warn people of that so they know what to expect, but that's why it's usually not included in supplement blends. But if you can get past that and it doesn't bother you, then it is a great supplement for male fertility. Now, things to avoid. So these are all the things that I am comfortable saying. You don't need to talk to anyone. You can cold turkey off of all of these things. The first one is going to be your cigarettes or your e-cigarettes or vape pens. They are not great for you for many reasons, but specifically your fertility. Same thing with cannabis, any sort of marijuana products, again, smoked or edible, they've been researching it more, especially now with the legalization of marijuana in so many states. They're doing more and more research because consumption has increased. And the studies are definitively showing that it does have a negative and sometimes hugely negative impact on fertility potential. Excessive alcohol consumption. Now, what one would consider to be excessive, in the clinical world versus your personal life might be two different numbers. So when I say excessive alcohol, I'm talking about anything more than 7 to 8 drinks containing alcohol per week. So anything above that, the research shows that it does see some steep declines in sperm quality once you get past that 7 to 8 drinks per week. Saunas. So saunas, steam rooms, hot tubs, those saddle sports, anything we talked about earlier, those things that heat the scrotum. We want you to avoid all of those things. Now, some of those things are not unhealthy habits, in your normal day-to-day life, but they are not good for your fertility. So those are things I would say to pause during the times that you're getting ready to or trying to conceive. And then, of course, talking about medications that can impact your sperm health. Again, I'll repeat myself. Please don't cold turkey off your prescription medications without speaking to your doctor who's prescribing those. But do educate yourself and be aware about what medications you're taking and their potential impact on your fertility. It's good to make sure you're having those conversations with your pharmacist or your doctor. And then ice baths or cryotherapy. I know those aren't heat things, but they are very popular, and they're getting more and more popular. People are buying these cold plunge pools for their homes. The worst are the athletes I work with, because they're telling me they're going from the sauna to the ice bath. You're shocking your system in both directions, hot and cold, which really does wreak havoc on your fertility. So I would say that if that's something that you have been partaking in, I would take a small hiatus from that during this time that you're trying to conceive. I think like a polar plunge or an ice bath is like my worst nightmare, but people seem to like it. So I would tell you just to avoid those things temporarily while you're going through this process. Now, so I know that's a lot. So sperm, we'll get to the fun facts that you probably weren't aware of. Sperm have a life cycle. If you want to be really technical, that life cycle is somewhere between 72 and 74 days, depending on who you talk to. But you want to keep that in mind when you're considering timeframes for conception. So any positive changes that you're making in your lifestyle or supplements you might be taking, they need to be done so consistently for a minimum of 90 days. I tell people think in 3-month increments, right? And that's to see the peak improvement in sperm quality. Your sperm are not cycling all at the same time. So every single day, new sperm are coming into maturation. Older ones are being either reabsorbed or expelled by your body, usually a combination of the two. So you want to keep in mind that you really do need a good solid chunk of 90 days of these positive changes. Now, taking one walk or taking supplements twice in the course of 3 months, not going to help you very much. So you need to be consistent. Consistency is key when you're doing all of these things, remembering that. Now, testing male fertility first. This is easy, painless to do, especially if you're doing it from home. Then you eliminate that awkward step of doing this in person. It's funny, the United States is one of the only countries that doesn't test and treat the male as a first step in the fertility journey. So if you were to live in countries like Germany or Spain, they always test men first. It is much less expensive, it's non-invasive, and it's much less invasive overall when you need to treat male fertility issues versus female fertility issues. In the US, we oftentimes just funnel couples straight into IVF, in many cases unnecessarily. I have seen many couples who've landed in IVF clinics and been directed to IVF, and the male has never even been tested, which still blows my mind that that happens nowadays. In a clinical setting, fertility, in the old ways, fertility was tested after 12 months of trying to conceive unsuccessfully. Trying to conceive, meaning with timed ovulation and intercourse. That is an entire year wasted if you don't know what your partner's fertility looks like. The newer way of doing things is being a little more proactive. You can do this from the comforts of home. You don't need to go to the doctor's office for this. You don't have to have that oh so awkward in-clinic experience. Producing a sample while you're listening to people in the hallway talk about what's for lunch and what they're doing on the weekend. There's no waiting times for appointments to do male fertility testing. There's no waiting for follow-ups to get your results because many times they don't release the results to you until you go in office to receive them. And it can be hard to get those appointments for some people even months out. So when you're doing this type of testing from home, results are available within 24 to 48 hours. So these are really quick turnarounds, and understanding your baseline fertility and being able to then make any appropriate changes can really save a lot of time, money, stress, and heartache, and just the not knowing. And I think, the worst time to find out that you're experiencing fertility challenges is after a year or more of trying to conceive unsuccessfully. That's just added stress nobody needs. So where do you start? So the first step is figuring out which test is right for you. So you've got two options for semen analysis tests. They're quite similar. The first one is going to be your standard semen analysis. So this is going to contain information on volume, concentration or count, same thing, motility. It'll give you a total motile sperm count, and it's going to talk about morphology. Now, there's also an advanced semen analysis. So the advanced semen analysis includes everything I just listed in the standard, but that is adding in that one additional piece of that DNA fragmentation testing. Now, how do you decide which one is right for you, or if DNA fragmentation testing specifically is right for you? So I would say anyone who's looking for a more in-depth view or look at their fertility could elect to have DNA fragmentation testing done. People who really should be doing it, though, where I would say it's almost more necessary, are going to be infertility patients. So these are people who are experiencing unexplained infertility, meaning these are the people that have been trying to conceive unsuccessfully with no clear understanding as to why. These are patients who've already been diagnosed with male factor infertility of an unknown cause. These are going to be patients with a history of miscarriage or recurrent miscarriages. This could be people with poor embryo quality who have already started the IVF process, but their embryos are not of great quality. This is also maybe patients who know that IVF is going to be their necessary method of conception in the future, but maybe they haven't started that process yet. A lot of IVF clinics now are even mandating DNA fragmentation testing prior to starting IVF cycles because it is such a good indicator of likely conception success. Also, any man over the age of 35, any man with a history of any sort of cancer, men who are taking prescription medications, specifically some of those medications I mentioned earlier, but not exclusive to those. Also, anyone that has any lifestyle habits that might impact sperm health, such as smoking, marijuana use, or any of the other things I mentioned earlier. Those are all people who should be doing DNA fragmentation testing. Now, how it works in general, it's pretty simple. So the process is somewhat similar, whether you're doing this in person or at home. So you're going to be collecting a sample via masturbation. That sample is going to be analyzed in a laboratory, and then you will be receiving the results. When you're doing it with an at-home testing company like Legacy, this process takes just a few days. It's slightly different when you're doing it in a clinic setting because, again, there are going to be some required doctor's appointments that need to happen first. So you need to be scheduled, get in, make an appointment at the lab to do the sample production. And then sometimes it does take a little bit longer to get those results. But the process overall is the same. Now, this is a screenshot of a Legacy report, a result report from a client dashboard. So semen analysis reports can be very confusing. We try to make this as easy to understand and as digestible as possible for people. So Legacy is reporting on all of the key metrics, but what's nice is there's also some included extras here when you're in your client dashboard. So there's going to be some expandable categories. Under every single metric. We have one shown here blown up a little bit bigger for you to see motility, but you'd be able to do this on all of your metrics where you can open these categories up, and they're just going to give you a little bit further insight on what that metric means, where you were, and if needed, what you could do to help improve upon those parameters. So, anytime you're reviewing a report like this, it's nice to have those added features where you can kind of expand upon it even more. For some people, especially people who are receiving normal test results, this is really sufficient. They can go through, they can read all of the blurbs and information, they can learn more about each particular topic and have a good understanding of where they stand. I think that sometimes where it gets complicated is when people are falling outside of the normal ranges. So what if your results are not normal or abnormal? First thing I tell everyone is please don't panic. Just because a result is outside of the normal reference range does not necessarily mean that there is a problem. So this is where it can be really important to educate yourself, speak with a professional in the field who can help you better understand your results and specifically what they mean for you. So there is additional testing available. Additional testing is not necessary for everyone, but it might be something that comes up in conversations with a specialist, which is the only reason I'm even bringing it up. And that's if there are concerns identified after semen analysis testing and a consultation happens. So this could mean they could be talking to you about things like STI testing, hormone testing, possibly doing a scrotal ultrasound, or some anti-sperm antibody testing, or even genetic testing. But again, most people will never need to have any of these done. It's just something that could come up in conversation, so enough that it's worth mentioning. Now, getting the timing right. So that last step in trying to conceive. Hopefully everyone is still with me, because now we're getting to the good stuff. So this is the fun part. Finding your fertility windows. This is very important. So a woman is only fertile for a few days every month, and you only have a 25% chance of conceiving monthly. And this is assuming that this is a person who's having normal monthly menstrual cycles. So tracking and understanding this information is critical to success in conception. So how to track? Usually I recommend that people track ovulation using two different methods of tracking. This can be with a period or ovulation tracker app on your phone. The free ones work just as well as the ones you pay for, so it's up to you if you're willing to look at the ads or not. But I tell people really the free ones are perfectly fine, and there's not one particular one or brand I would tell you to get. So you can use those apps. There are some ovulation prediction test kits or LH test strips that you're going to be urinating on daily, or there are wearable devices like an Ava bracelet. Typically, I like people to use those two different methods because they are helpful, but these are not perfect. None of these are perfect. This is not an exact science here. Also, intercourse patterns to consider. So more fun facts for you are that one, sperm can live inside of a woman's body for up to 6 days. So this means that it is possible to conceive essentially almost a full week after having intercourse to begin with. Also, women ovulate off cycle all the time. This is exactly why the rhythm method of birth control is so ineffective and does not work. My mother was born in the 50s. She is the oldest of 17 children, courtesy of the rhythm method. So I can guarantee you it does not work. Now, keeping those fun facts in mind, we're looking to see just in general, an overall increase in intercourse frequency. Now, that is just basically saying that some semblance of a pattern that looks like every 2 to 3 days per month, you'd be having intercourse. But specifically, I want you to still continue to track. And then starting 3 days prior to ovulation, and I usually tell people track using two methods because sometimes your ovulation windows won't match up. One method is going to tell you one thing, another method is going to tell you another. If they tell you separate ovulation windows, go with the assumption that they're both correct, because really nobody can tell you which is or is not. So you're going to be starting 3 days prior to ovulation until the end of ovulation, having intercourse once per day. You can skip a day in between if you like. You don't need to do it once per day exactly. None of this is gospel. Some semblance of that type of a pattern. This is the point where some people want to high five, but other people want to, throat punch me. I think that, it's received very differently when I give this information, but overall, just some semblance of increased intercourse frequency is the message. Now, sperm in storage, so to speak, not actual cryogenic storage, but stored sperm, meaning held in the body, gets worse with time. So regular ejaculation is important. You should be ejaculating regularly for the healthiest possible sperm and best chances of conception. Long stretches of abstinence are actually not good for your sperm quality. I had a patient recently who I had a consult with who had terribly low parameters, and we really just couldn't hash out why. And at the end of our conversation, he disclosed to me that he did not follow the instructions and had actually abstained for 30 days because he thought that after 30 days he would have such powerful and high sperm numbers that it would just be the best possible result he could have. Then we had to have that difficult conversation about, he actually did quite the opposite, unfortunately. So it would always have the opposite effect when you abstain for really longer stretches than even 5 days. 3 to 4 days is the magic window. That's the number. I joke often with a urologist friend of mine. I insist 3, he insists 4. I tell people that if you can't decide who's right, split the difference, call it 3.5 days. But that's the ideal abstinence window for testing purposes, because that really gives you the best balance of highest concentration and motility before things start to go awry. Beyond that 5-day point, that would be what we would consider to be old or stagnant sperm, and typically of poor quality, and that quality drops significantly as the days go on beyond 5. So definitely more time is not your friend. Also important to discuss, and I always bring this up, it's masturbation in general. So I will caveat this with the fact that masturbation is a normal and healthy thing. There is nothing wrong with it. But when you are trying to conceive, the only time you should be masturbating really is for medical testing purposes. If you're someone who can ejaculate multiple times daily, good for you. That's great. But your counts and motility are not going to be what they need to be for conception. So it really is best practice to save all of your efforts for conception. You also need to keep in mind that your body needs recovery time. So yes, you might still be able to ejaculate again, but your concentrations, your motilities, they're just not going to be where they need to be in order to conceive. So now, what if it just doesn't happen? You've done everything you're supposed to do, things just aren't happening. Now what? So when do you seek additional help? When do you seek out a specialist? What do you do from here? So I'll start us off with additional help. There's lots of it available, and my recommendations for when you should be seeking that out vary somewhat. So if you are under the age of 35 and you've been trying to conceive for 12 months or longer, when I say trying to conceive, that means with timed intercourse and tracking ovulation, because if you just are, well, we're not using protection and it isn't happening, that technically isn't considered trying to conceive from a medical standpoint. Then you should be speaking to someone or start looking into testing if you haven't already. If you are over the age of 35 and you've been trying to conceive for 6 months or longer with, again, timed intercourse, and you're not seeing successes, you should be looking into testing if you haven't already. Also, if you have done a test, you have abnormal semen analysis results that are not explained by things like user errors when producing the sample or lifestyle factors. So that means, things I've heard, I dare say more than once, many more than once, are things like, oh, I spilled my sample, I knocked the cup over, I scooped it back in as best I could. Basically assume that test result is inaccurate. Or someone who, maybe forgot to ship it back in a timely manner. Some poor timing where they, were not able to have the cup open in time. They missed the cup. Some of the sample went in the cup, some went elsewhere. All of those things, basically, that doesn't count as, someone who has a poor semen analysis report, because those are typically just user error issues. I would consider those results to be completely inaccurate. But you are going to want to meet with a specialist or someone that can help if you're having other things that are not explained here. So when deciding who should see a specialist or which specialist to see, that's going to be, if you're having an abnormal semen analysis, you're probably going to want to meet with a fertility specialist who is maybe a specialized urologist. Urology is a very broad field. And I've worked in it for the last 10 years. And I tell people, they ask all the time, who do I go see? I said, well, man, it depends on what your problem is. If you've got, renal cancer, I have the person for you. If you have bladder cancer, I have the person for you. And if you have fertility challenges, that person is someone very different. So urologist, it's a very subspecialized field. You want to see someone who specializes in men's health specifically. That's a commonly used term for male fertility urologists, or someone who is fertility based. Fertility won't always be in their practice name, but men's health is a good indicator that they're working in male fertility. Um, so these are specialized urologists who can prescribe fertility medications that might be necessary. They can perform testing as well as procedures, even surgical procedures, if you needed to address something like a varicocele. Um, on the other end, on the female side, a reproductive endocrinologist is a specialist that focuses on the female partner. They can prescribe female medications. They can perform procedures such as IUI or IVF. In some cases, if the female lands with a reproductive endocrinologist before the male partner has done any testing, they'll order a semen analysis sometimes for you, but typically they're not treating any male fertility issues. They'll just facilitate some of the testing if it hasn't happened yet. Now, there is good news in all of this. So 85% of couples are able to conceive within 12 months of trying. So this isn't all doom and gloom. And I know I did talk a lot about some of the negatives and the things not to do and to watch out for and that could be wrong. But, the bigger picture that I want you to take home with is the fact that, yes, 85% of couples are conceiving within 12 months. So there is hope out there. And if you're someone who has been struggling, I don't want you to walk away from this presentation and feel like, oh no, this is terrible. That is simply not the case. Hopefully this information proves helpful for many of you. This is a very broad overlook of a really complicated topic. But I just want to thank everyone so much for taking the time out of your evening to be here. And thank you, Alicia. I appreciate you moderating and facilitating.
Absolutely. Thank you so much, Steph. That was super, super informative. I just love listening to you explain things. I feel like it makes sense when you explain it. Let's move on to our questions. I'm going to start with some of the questions from our Eventbrite that folks asked before the event started. One attendee wants to ask about increasing fertility while on TRT. For context, TRT is testosterone replacement therapy. So one of those medications that Steph mentioned earlier that does have a negative impact on fertility. So if someone is taking TRT, Steph, what's something that they can do to improve or sort of maintain their fertility?
That is a good question. That's a topic you could go on and on about for quite a bit. So testosterone, sometimes people think, oh, fertility, I want to have a baby, testosterone, that's what's going to help me. Anytime you're taking exogenous testosterone into your body, meaning your body isn't producing it itself, so whether it be through injectable form, oral medications, transdermal form, pellets, anything, your body is recognizing that that testosterone is present. And so your brain is signaling your testicles to stop producing it. So anyone who's taking any sort of testosterone for any reason, that is going to have a negative impact on their fertility potential. For some people, it will drop their sperm parameters to zero. Many cases, it won't be quite zero, but it'll be too low for natural conception to occur even. And there are those few who somehow, with no rhyme or reason to it, who will hang on to their fertility and still be able to conceive while on testosterone. My first piece of advice, and I work often with patients who are getting ready to start on testosterone therapy. First piece of advice is going to be to, if you can, freeze a sample first before starting that journey. If that ship has sailed and the person who asked this question, let's say if they're already on the testosterone, then I would say test as soon as possible, get an idea of what your baseline is now. So you have options. You've got a few options. A lot of doctors will prescribe medications in conjunction with testosterone in an attempt to try and preserve sperm production. So that could be a medication called HCG, most commonly. That's another injectable medication. It doesn't work 100% of the time. So many times people think they're going to be okay because they're taking these other medications or they're cycling on and off the testosterone periodically. So they assume that their body will be able to trigger sperm production again. But there's absolutely no rhyme or reason for when your body's going to say, nope, I'm sorry, I'm done doing that, and just stop producing sperm. So having something frozen to fall back on works as a great insurance policy, so to speak. And I would encourage that. I would say, definitely test, figure out what your numbers are. that's someone that I would recommend speak with a specialist. In some cases, hey, if everything checks out normal, you probably don't need to talk to anyone in a lot of cases. But if you have a complicated personal situation where you're on a medication that can impact fertility, or you do a test and see it's impacting your fertility, you definitely want to sit with someone, and they can get real specific with you. I do this often with people where we're hashing out what you're on, how people might need to transition onto a different fertility safe medication that can increase testosterone temporarily, or in order to have enough sperm that they could preserve something, or so that they can try naturally. It gets very complex, but that's where I would start.
Great. Okay, another question, and this is actually one I'm wondering about personally since I read it. So we talked a little bit about excessive drinking, but this attendee wants to know how much does one night of excessive drinking affect quality in the short term or the long term? So not like like often drinking excessively, but like one big banger night.
Yes. I've been asked that a lot. So what about that bachelor party that I just went to? I was just in Nashville. I had that conversation with someone today, actually. So super common question. The answer is I can't give you an exact answer. No one really knows what one binge drinking episode would do to fertility, if it would have that much impact, if any. I would say that it's less likely to be as impactful as someone who's drinking regularly, having 1 to 2 drinks a day. People might think, oh, that's way better than having 8 drinks a night. But that 1 to 2 drinks a day can be cumulative, and you've got to think in the course of the long term over weeks and months. So, the long and short of it is one night of excessive drinking really may or may not impact fertility, but definitely just be conscious of those numbers, keeping it overall to less than 7 drinks containing alcohol per week, just across the board. And that should keep you in a pretty safe space.
Okay. Does taking an enhancement like Viagra tamper with your fertility?
That's a great question. One that I have received many times. A lot of people find themselves needing assistance when they're trying to conceive, because there's a lot of pressure, especially to perform on demand. And so that can get really stressful and problematic for men when they're trying to conceive. And I don't think we always realize how difficult that can be. It's like, okay, today's the day, now's the time, I'm ovulating, we got to go. And if the stars haven't aligned and the mood isn't right, it can be very difficult. So many men find themselves needing low dose Cialis or Viagra while they're going through this experience of trying to conceive. There are no studies that prove that any sort of erectile dysfunction medication specifically would have an impact on fertility. So that is good news. But I would say that what I can tell you, though, are high levels of oxidative stress in general are going to negatively impact your fertility potential. So sometimes those added stressors of maybe people who are struggling with performance anxiety now because they're really being put on the spot, or the stresses of I need to perform multiple times in a day, which I tell people isn't the case. Once is sufficient, because any of those subsequent ejaculations are not going to be of good enough quality in most cases to allow for conception to occur anyway. So not to stress yourselves out thinking you need to, go 5-6 times in a day. You don't. But yeah, it's a very common question that most people don't want to ask, but should. It's important to know. So if people are struggling while they're trying to conceive with issues temporarily with erectile dysfunction, when that has not been a problem in the past, they should talk to their doctor about maybe getting a low dose prescription to help get them through that time period anyway.
Sure. Okay. I have 2 questions, one from Eventbrite and one from here that I think speak to some of the same issues. One is, will my fertility center accept your test results? And the other is, can you talk about the reliability or validity of for semen analysis compared to in-clinic testing? So I'm assuming what this person means is the validity of Legacy's test in comparison to a clinic. So can you speak a little bit about that?
Yes, absolutely. So I'm assuming that I'll answer it, assuming that that's the way they're asking. If the person who posed the question wants to post a correction, if I'm answering something that they weren't asking, let me know. So reliability, validity of semen analysis testing. So I can speak to Legacy's, and I can speak in general to just general in-clinic testing, not one particular clinic, because I can't speak for any individual clinics that I have not been into. Legacy and in-clinic testing is done exactly the same way. So these are computerized microscopes and lab testing. Legacy has CLIA certified labs. They are FDA registered. This is the same exact testing process that happens whether you're doing this in a hospital or clinic setting versus doing it from an at-home testing company. The reliability is essentially the same. Of note, there is one slight difference when doing this in person versus in person in a clinic producing a sample versus via the mail. So legacy, when you do this through the mail, we send you a transport buffering media. That is really important. That is the piece that preserves the motility during time in transit. So when that specimen is being shipped overnight. Now, it's important to use as directed, obviously, following instructions. But if someone has done that, the transport media does a phenomenal job at preserving motility, but it's not 100%. So there's always going to be a very slight decline in motility when you're doing this through the mail. It's usually not a very significant number. And in most cases, it wouldn't impact your ability to use your sample in the way you hoped. Again, unless there were some user error components that happened. But these tests are all run and done exactly the same way.
Great. We have a really interesting question here in the Q&A box, which is if people are having sex because they're trying to get pregnant, who should come first? The male partner, the female partner, doesn't matter.
It doesn't matter. So for a good time, everyone should, but in reality, it doesn't matter. It doesn't make a difference. People ask that question all the time. I mean, I've worked in men's health for the last 10 years, treating erectile dysfunction, prostate issues, and infertility. So this is an everyday conversation. And you laugh because I've heard people say, well, if I do a handstand afterwards, how long do I have to stay in the handstand after having intercourse? And, and does it make a difference if one person does finish and the other doesn't? And at the end of the day, it does not make a difference. And you don't need to stand on your head either. That doesn't make a difference. So just the only thing I really tell people is obviously nobody should be jumping in a bathtub or using any sort of vaginal cleansers or douches or anything like that after intercourse. You want to just leave things be.
Yeah, actually, this is not a question, but something that we've been asked on the content team a couple of times is like, is there a particular position that is like more likely to help people conceive? Which I think the answer also is no. It's like whatever's working.
Whatever makes you happy is my answer typically. But yeah, very similar question, and it's whatever works for you.
Cool. Okay, another question from the Q&A box here. And I think we'll do this one and one more, and then I think we're at time. So I want to respect everyone's evening plans. So when trying to conceive and attempting to live a healthy lifestyle, how often should we be testing the impacts on sperm? How much variation is there sample to sample? I love this question.
I love that question too. Yeah. Whoever asked that, thank you. That is a fantastic question. So it's always a good idea if you're even thinking you're someone who may want to have a child at some point in your life. It's always a good idea to have baseline testing. Just do a semen analysis and figure out where you're at. What you want to keep in mind is that these are very highly variable results. So, I mean, like I said before, earlier, we talked about sperm having a life cycle. So, I mean, you're never going to get exactly the same number. I don't know anybody that would do this, but if you were to test, once a week over the course of, 12 weeks, your results are going to look like an EKG wave. They're going to go up and down, and they're going to be varied. They'll be somewhat in the same ballpark, but they're going to vary. Now, once you start talking in blocks bigger than 90 days, things could take drastic, peaks and valleys. And that is just life is happening. So the changes in your environment, in your activity level, the weather, have you been sick or ill? Did you have surgery? The inflammatory process your body goes through when you're healing. And I'm talking surgery it could be your foot. I mean, it has nothing to do with your scrotal region, but just the inflammatory process that happens post-operatively for anyone. All of these things play a part, in what those parameters might look like. So aside from baseline testing that I would recommend pretty much for everyone, and I'm always telling people the benefits to just freezing a sample just in case are immense, but I would say if you're just going through the process, you're trying to conceive, the most frequently, and I don't think it's necessary for everybody, but every 3 months, if you're just looking to see where you're at, it sort of works like an A1C would for a diabetic. It gives you an idea of what's been going on for the last 3 months in your life. But typically, more realistically, I would say, if you're actively trying to conceive and not seeing success, in 6-month increments, or some people do this just as part of when they go and they might have an annual physical, and maybe once a year they do this test just to see what's going on. It is a good indicator, as far as what's going on just with your overall health as well. So I would say somewhere, depending on what your individual specific situation was, you can decide what works for you. Every now and then we get the one-off person who just tests all the time because they're curious. Or we had one patient not that long ago who said he was competing with himself, taking supplements and watching those numbers tick up. And he said he got to the point where his wife got pregnant, but he said, I was just curious to see how big the number could get. And eventually he did plateau out and it was fine. But I mean, if that's what entertains you, you can do that as well.
That's great. Thank you so much.